Miss Georgia.
Hello.
I don't know if you remember me from last time, but it's Nicole. It's nice to see you again.
Nice to see you too.
So I see you got your wrap on, and I always look forward to see what you're going to do with your hair next.
Thank you.
I'll have you sit over in the chair. It's probably a little more comfortable. Alright. So I had you coming in today just to check up on your diabetes and your high blood pressure. Does that seem about right?
Yes.
Now, is there something else that you need to talk to us about today?
Yes, I'm having some knee pain.
Okay, some knee pain. And
It's going on for a couple days now.
oh, okay. For a couple days. Alright, so that's kind of a lot on the list, so diabetes, high blood pressure, and knee pain. Now, what seems to be kind of like important for you to talk to Terry about today?
My knee the most because it helped. I just have a hard time walking.
Okay, yeah, oh, that definitely seems like that would be quite a big problem. Alright. Now, did you happen to bring in your BG log?
I did.
Oh, perfect. Oh, look at that. Awesome. Very good. Alright, they're looking pretty good. So, I'm going to leave this actually out for Terry so she can look at it. So, seeing that your blood sugars are looking pretty good, and depending on your blood pressure, I think that'll leave quite a bit of time to talk about your knee. So, I'm going to do your blood pressure real quick. Is there any arm that's better than the other? Does it matter?
Doesn't matter.
Do you mind if I have you take your arm out of your sleeve? And I apologize if this is a little chilly.
You are so polite.
Thank you. Alright, just go ahead and relax it. And we'll do this. While that's working, I'm just going to pull up your meds real quick. And I just want to make sure you're still taking the metformin 500 twice a day. And then it looks like you take lisinopril 20
Yes.
milligrams.
Yes.
Okay. Were you taking anything for your knee?
No, I haven't taken anything yet.
Oh, look at that. That's a beautiful blood pressure. 119/74, so that lisinopril's working real good. All right. Very good. All right, Miss Georgia. Thank you so much. And Terry will be in just a couple
All right,
minutes.
thank you.
All right. Okay, so Georgia's on today to talk about diabetes and hypertension. She did bring a BG log, which I left it in there for you to look. BGs have been looking really good. Blood pressure is 119/74. But she did bring up she's having a lot of knee pain, and that's kind of new for her during the past couple of days, and that seems to be very important for her to talk about today.
Okay, so we'll go over the changes in the living room.
I did. So I will run that, and it should be ready in just about 6 minutes. Thank you.
Hello, Miss Black. Hi, Miss Regan. Good
Hi,
to see you.
You too.
How's the kids?
Great.
Good.
Great.
Okay.
Saw the grandkids yesterday. It was awesome. Had a nice little barbecue.
That's good. I'm good. Glad to see you. Well, welcome. And it looks like you booked this appointment for follow-up of your diabetes and your high blood pressure, but Nicole did tell me that you were having some pain in your knee.
Yes, it has
Okay.
hurt me a lot yesterday during the barbecue.
Yes.
So I just want to get that checked out.
Okay, so that seems pretty important. So why don't we start with that, and then we could talk about the other issues of diabetes and the high blood pressure, because I
Okay.
do want to get to that today as well.
All right.
Okay?
Sounds good.
Great. All right, so why don't we start with your knee? Tell me about the pain. How long have you had it?
It happened for a few days now.
Okay.
And when I first wake up and I go to step off my bed, it hurts.
Right.
And then yesterday I was having a hard time walking, and like almost like it went out a little bit. Then I sat down for like 5 minutes, and then it was okay.
Okay, so it looks like you've been touching the right knee. It's the right knee that's
Yes.
bothering you.
Yes.
Okay. All right. Did you take anything for the
I
pain?
have not taken anything yet.
Okay, no. And have you had any problems with this knee before?
No, it just started, which is random to me.
Okay.
I didn't fall or bump or anything like that.
Good, good. No swelling or redness?
No.
Okay.
Just it seems to give out a little bit. Well, I guess maybe I put too much weight on it. I'm not really sure.
Okay.
But yeah.
Okay. All right, very good. And no problems with the left knee?
No.
There's no pain in the rest of your leg, so not in your hip, not on your thigh, not in your calf.
No,
just
in
the knee.
Yes.
Okay. And again, no problems with this knee in the past?
No.
Okay. Well, we'll definitely have to take a look at that.
Okay.
Okay. So Nicole did give me a copy of your blood sugars.
Yes.
And it looks like they've been doing a lot better.
I've been trying. I didn't want you to be mad at me when I come in, so I've been trying.
Well, I do appreciate that. Well, that's good. And it looks like you've been trying. That's great. So you're taking your medication every day?
Yes.
What are you taking for your diabetes? Do you know the name of your medications?
I don't remember. I didn't bring the list with me because I always forget to bring it when I write it down.
That's okay. It looks like Nicole did go over this a little bit with you. So how many pills do you take for your diabetes?
I take 2.
Yep, that's about right. Okay. So what I'll do is at the end of the visit, I'll give you a copy of your medication list so that you can have that with you. So that way you know the names of the medications.
Okay.
That's important in case you may have to go to another office or see another doctor in the emergency room. They're going to ask you for your medication.
Okay.
So it's good to know the names.
All right.
Okay?
Yeah.
That being said, like I said, your blood sugars are looking a lot better than they were. How's your diet? What types of things are you
Well,
eating?
I'm not gonna lie. Yesterday, because of barbecue, I had me some chicken and some ribs. But
Okay.
other than that, I do eat healthy during the other normal weeks.
Okay.
Eat breakfast, lunch, and dinner small.
Right.
Yeah, fruits and vegetables.
Okay.
I do that
Okay. So when you say eat healthy, fruits and vegetables, about how often?
once a day.
Okay. We'll talk about that too. But that being said, I'm not going to beat you up too bad yet. Your blood sugars look a lot better. Nicole is running a test, your hemoglobin A1C test, so we can see just how well controlled your diabetes is. You remember what the hemoglobin A1C test is? What we did with that?
Blood, right?
That's
Okay.
a blood test. And what is that test supposed to be
Testing
for?
sugar in my blood.
Mm-hmm.
Make sure I'm taking my medicine and eating right.
Pretty much. That's
Okay.
what, and how often do we check that?
I don't remember.
Okay, so that's okay. That's why I'm asking, so that you have a clear understanding of what
Okay.
that means. So that's a test that we check every 3 to 6 months to see how well controlled your diabetes is. Okay.
Okay.
So the last time we checked it was 3 months ago, so you're due today.
Okay.
And hopefully, based off of
Fingers
these
crossed.
numbers, it's going to look a lot better. Okay.
Okay.
The number that we're looking for is anything below 7. That's the goal.
Okay.
Okay. So let's see where we're at today. All right. And you're also here for your blood pressure, but you know your blood pressure is looking pretty good today. You're
Okay,
taking your
yeah.
medicine.
Yes.
Good.
Yes.
Not feeling any headaches, chest pain,
No.
shortness of breath. And it shows your blood pressure looks great today. Okay. So why don't I get you up here on the table so I can examine you?
All right.
Is that all right?
Yep,
I'm going to
all
listen
right.
to your heart and your lungs. I want to check that knee out
Okay.
too. Okay.
Right.
All right. Good. So it was a family barbecue that you went
Yeah,
to? That's right.
it was
Yeah.
awesome. See all the kids playing the games, things like
Oh,
that.
that sounds like fun.
Yep. And it rained a little bit, but it was still good to have the family around.
Yeah, that's always nice. I like hanging out with my family too. I miss them. They're far away, so I do kind of miss them.
Everybody's okay though?
Everybody's good.
Oh, that's awesome.
All right, I'm going to listen to your heart and your lungs first, okay? Good. Your heart sounds very good, okay? And listen to your lungs. Take a deep breath in for me. Good. And again. Great. Sounds nice and clear in there, okay? Okay, so this is the one that bothers you, correct?
Yes.
Okay. All right, I don't see any swelling today. Any pain when I press in here?
No, it's just a little sore, not a whole lot.
Okay, how about behind here?
A little bit.
A little bit?
Yeah.
Okay. Have you ever had any x-rays of this knee?
No.
No, okay. All right. All right, I'm going to pull this out. Okay, can you bend this knee up? Great. Pain?
Just a little
No.
sore, just
Okay. Okay. All right. Okay. I don't feel anything overly abnormal in your knee. I don't have my x-ray vision working. You know, we may need that down the line just to figure out, especially if the pain gets worse,
okay.
to make sure that there's nothing else going on here that could be more serious. But you could have just strained it. I would recommend some physical therapy for you.
Well, that's a little bit of a problem because I have a hard time getting around,
Okay.
and my kids work and
Okay.
things, so it's really hard for me to get to an appointment.
Okay.
My son was off today, so he was able to take me today. So is there any way we can I can get medical transportation for that, or?
Absolutely, yeah. I mean, it seems like, you know, you're having a hard time getting around, and especially with the pain in your knee. I think we might be able to arrange that. Okay, so I'll work with our transportation nurse to see what we can do there. I'll submit the application, and you should hear something about that soon.
Okay.
Okay,
All right,
and then
that's
I'll put
awesome.
in the referral for the physical therapy. You should get that in the mail.
Okay.
Okay, now just looking at this here, I'm going to show this to you. So, your blood pressure, like I said, looks great.
Mhm.
And your hemoglobin A1C is much better. It's 7.5. That's lower than what it was before.
Okay.
So you're going in the right direction.
All
okay?
right.
So I won't make any medication changes today, but keep working on the diet, a little more fruits and vegetables.
All right.
Okay?
All right. Thank
Low
you.
carbs, not as much sugar. Okay?
All right.
Get some activity when you can, but let's get this knee better. all right?
Okay.
As far as your blood pressure goes, keep taking your blood pressure medications, okay?
All right.
I won't make any changes there.
All
Okay?
right, thank you.
Can you explain back to me, just so that I have a clear understanding that you know what we talked about today, what we're going to
Yes.
do in regards to your knee?
Yes, we are gonna set up some for physical therapy, and possibly if it gets worse, some X-rays down the line. Keep taking my medicine, add in some more fruits and vegetables, more than once a day.
Great.
And
Great.
my blood work on itself looks good.
Right. And don't forget, I'm going to do something about that transportation
Yes,
fee. So you
please,
should hear
thank
something
you.
about that soon.
All right.
Okay.
Looking forward to it.
All right. I'm
All
going to
right.
have Nicole come in and finish up with you.
All right. Thank you
Good
so
to see
much.
you, okay?
You too.
All right.
Tell family I said hi.
I sure will. Take care.
You too.
So I'm going to give her some for some physical therapy. Okay. So we'll get that referral going. But she's going to need some medical transportation, so I'm also going to put in an application for that.
Okay.
All right. Her diabetes is looking better. So I told her to work on some diet, exercise modifications, it's tolerated. And her blood pressure looks great, so I didn't make any changes to the medication.
So I went ahead and put out her visits on the great, and I'll just let her know about the physical therapy and let her know how you set up this weekend.
Great, okay, thank you.
Hi, Georgia. Okay, so right here, I'm just going to have a summary for you. This is kind of what you and Terry went over today. Your blood pressure is looking really good, so she doesn't need to make any changes on your meds. Your blood sugars are also looking good. Thank you so much for bringing your log. That was very important.
All
And
right.
she's going to hook you up with some physical therapy. So we'll send that out to our referral team. They'll make the referral, and then you'll be getting a phone call and a letter in the mail, kind of explaining the referral, you know, which group to go to. And also, she's going to help you out with some transportation. So
Okay, awesome.
we'll fill
Thank
that
you.
out, and now you should be hearing hopefully from your
Oh, you're
insurance.
so sweet.
Okay.
You're so sweet.
It's very good to see you again, Miss Georgia.
All right.
See you soon.
Bye.
Bye.